May is Osteoporosis Month, and today we're getting the facts on what it is and what we can do to try and prevent it. GBMC doctors Horowitz and Johnston are here to break it all down for us. Well, welcome.
Thank you.
So first, tell everybody, what is osteoporosis?
So osteoporosis is a condition of the bone. Bone is a very dynamic structure. You're constantly remodeling it. You're forming bone and taking bone away. Osteoporosis happens when you lose more bone than you form. You develop small little fractures within the bone structure, and that increases your risk for having large fractures.
So what causes it?
Oh, the cause of osteoporosis is multifactorial. So we see this more commonly in postmenopausal women because estrogen helps maintain bone mass. There are other conditions that can accelerate bone loss. There are certain medical conditions such as Crohn's disease or other malabsorption syndromes. Medications like steroids can accelerate bone loss. You see a greater loss of bone in people who smoke, people who drink alcohol. If you're not taking sufficient amount of calcium or vitamin D, that can accelerate bone loss. And you can see it in men who are, have low testosterone can also develop osteoporosis.
Okay, so how do you diagnose it?
So you can diagnose osteoporosis two ways. Clinically, if somebody presents with what we call a fragility fracture, a fracture that happens with, that is disproportionate with the impact that the person has. If they fall to the floor and they have a serious fracture, you can diagnose it based on that. The gold standard is a bone density study, which is an x-ray procedure that looks at the bone density at the spine, the hip, and sometimes the forearm. And this can give us an idea of whether the bone mass has been diminished and that person has osteoporosis.
So once somebody has one of these fractures, that's where you come in, right, Dr. Johnson?
That's right. We see a lot of patients who come in with these low energy fractures of their wrists and proximal humerus and pelvis, and unfortunately sometimes of their spine or their hip. And it's important, if you do have one of these fractures, a low energy fracture over the age of 50, once we treat the fracture, often with plates and screws or hip replacement, we want to not forget that osteoporosis is a disease that needs to be treated. So we need to get a DEXA scan to ensure that we can determine what your risk for future fractures is and treat you as needed.
So who should really be evaluated for it?
So any woman over the age of 65 who is postmenopausal should have a bone density. Men over the age of 70. Women who are postmenopausal but have increased risk factors, such as what I mentioned. They have medical conditions. If they also have a family history of osteoporosis or a parent who had a hip fracture, these are patients who should be screened.
Is there anything that we can do to try and prevent it?
Sure. Staying active is the key. Weight-bearing exercise, resistance exercise, making sure you get an adequate amount of calcium and vitamin D, improving core strength and balance are all things that prevent falls and therefore reduce your risk of having a fracture. And the reason why we want to diagnose osteoporosis is to prevent fractures.
So can you just briefly touch on what some of the treatment is?
Yeah, so there's a variety of medications that can be given for osteoporosis. There are oral medications that reduce the bone turnover. There's injectable medications that also slow the rate of bone absorption. And then there are other medications that are called anabolic medications. These actually form new bone. These are given by injection by the patient once a day for a 2-year course of therapy, and they can help create new bone.
And you actually have a model to show us the difference, right?
Yeah. Can show you. So this is, if you want to zoom in, you can see the, in this hand you have an osteoporotic, it's a patient with a t-score of minus 2.7 osteoporosis. You have the cortex here, cancellous bone, and then you can see how thin it is. I put my hand behind it, you can actually see my hand through it, and that's osteoporosis. And then after 2 years of therapy with an anabolic medication, you can see how it's thicker. The cortex is thicker, the cancellous bone is thicker, and you can imagine that this bone is stronger than this bone. So anabolic medications are one of the medicines that are available to help strengthen the bone to prevent fractures, which is our main goal.
Right, great information about a topic I really had not much knowledge of, but now I know what to do to try and prevent it. And anybody who has any questions about where they can get more information or come to see you, they can go right on gbmc.org, right?
Yep.
Excellent, yes.
Great.
All right, well, thank you so much for being here today.
Thank you.
Thank you very much.